Hello and welcome back to Focus Atlanta. Again, I'm your host, Keisha Lancelin. Thank you so much for continuing to watch. We're going to close out the show today talking a little bit about your sleep habits. The National Foundation's Sleep Poll is back, and we are here with Mr. Massey Arrington and Dr. Joseph Weissman from Decatur Medical Sleep Disorder Center. Thank you both for coming on the show.
Thank you.
Well, Dr. Massey, let me start off with you. Do a lot of people really suffer with sleep disorders or bad sleep habits?
About 40% of the population isn't happy with the way they sleep, and about 1/3 of the population at some point during their life will have either or insomnia or sleep apnea, the two most common sleep problems.
So how do we know when that's really important? You know what I mean? Everybody has a little sleepless night here and there. When should we really start getting concerned?
That's right. It is hard to know sometimes. Yeah. I think if it begins to impair your other activities,
okay,
or if it is present on more than 3 or 4 nights a week,
okay,
then most would agree. But obviously, there's a gray zone.
Okay, yeah, absolutely. And Massey, I got to tell you, I didn't realize that Decatur Medical had a sleep disorder center right here. Tell me a little bit about the longevity. How long have you guys been there?
Well, we opened in 1995.
Okay.
I believe it was March, actually, of 1995. We are fully accredited by the American Academy of Sleep Medicine. We're also accredited by the Joint Commission. We are also ranked in the, Decatur Medical in general is ranked in the top 5% in the nation for health grades.
Wow, that's fantastic. And I mean, that's extremely important in that here in Georgia, almost anybody can kind of open a sleep clinic, right? You don't always know that they're all as accredited and as good as Decatur Medical Sleep Center, right?
And that's an excellent point. There are no regulations for sleep disorder centers in Georgia, and it's very important that patients go to a facility that can provide them with adequate care. And being dual accredited, I think that's the best choice that patients can make.
Okay. So Dr. Massey, when someone realizes that it really is an issue in their life, that their insomnia, 4 nights a week is impairing their job performance, impairing their family life, what kind of treatments are there? What kind of things can you do for them?
Well, the most important thing is to find out what their problem is.
Okay.
With the most common problem being insomnia, one has to look at factors that are causing the insomnia. If it's sleep apnea, there are a different set of treatments for that.
Okay. Now, how do we know what's dangerous and what's not? Do you know what I mean? Like, people don't always recognize that snoring could be dangerous, or that sleep apnea, or can we give a little range of how bad it could be if you don't get it treated and take care of it? Or
well, the things that we use to measure the severity of sleep apnea are when it actually reaches a point of a prolonged apnea. Loud snoring is a risk factor. Excessive sleepiness during the day, falling asleep during what we call sedentary or not very busy activities, and of course things like falling asleep during driving, which is in a sense kind of a boring activity, is a big concern.
Okay, absolutely.
And blood pressure and can also be elevated by sleep apnea. So poorly controlled blood pressure may be in part because of sleep apnea.
Wow. And it's linked to so many different things, especially sleep apnea. And there are a lot of people who snore, and they don't do anything about it. Family members will hear about them. They'll make fun. You know, that guy on the camping trip, or that's Uncle Joe and he's shaking the house. But snoring is the #1 indication for apnea, and it's been linked to everything. Uncontrollable weight gain, stroke, hypertension.
Wow.
Well, this is the #1 treatment for obstructive sleep apnea.
Well, this is a CPAP unit. These are much smaller now than they used to be 5 years ago, but it basically consists of a pressure-controlled blower that in some cases can sense whether a patient's breathing in or out, and it's connected to a hose, and there's usually a humidifier unit, which we didn't bring with us, and then this is connected to a mask, and there are many different kinds of masks.
Right. Well, Massey, go ahead and give us a website to, where we can find more information if indeed, like you said, there's, snoring going on and we're not paying any attention to it and we don't realize how severe it may be.
You can find out more about our program and all of the Decatur Medical services at www.decaturmedical.org, and the Sleep Disorder Center is listed right on the home page. And also, you can also find out more information about the National Sleep Foundation poll at nsf.org.
Excellent. Thank you, gentlemen, for coming on
Thank
the
you.
show and showing us all of this information and making sure that we all recognize how important this can be. So please take the opportunity to visit the website and learn a little more. If, in fact, this is you or your spouse or your father or someone that you know, it could be very important. So please take the opportunity to learn more.